Unsiloed podcast is produced by University FM, elevating the stories of your institution.
Welcome to Unsiloed. I'm Greg LeBlanc, and I'm here with David Zweig, who is, I was going to say, a novelist and a musician and, of course, a journalist. Right? So we've got a lot of different things going on. And also the author of a couple great books. Most recent book is this one. It's called An Abundance of Caution, American Schools, the Virus, and a story of bad decisions. And this was preceded by this other book I remember from, probably a decade ago or so. It was called Invisibles, the Power of Anonymous Work in an Age of Relentless Self-Promotion. Welcome, David.
Thanks for having me.
Well, this book, Abundance of Caution, it is a book about a lot of things. It's partially a memoir because you walk through your experiences as a parent and your dust-ups with your local school board, trying to engage in a conversation about the school closure policies. But it's also a book, I think, about public health, about expertise, about the state of science in the world today, about partisanship and how ideologies or tribalism have infected, academia, sciences, the public sector, across the board. And as we were saying right before the podcast started, this is something which hopefully right, will be a historical account that people will look back to for many years at the micro level, just to kind of figure out what the heck happened during those years of craziness from 2022 to 2023 or so. I don't know when it officially ended. And I think what's important to me is that we don't forget. Typically after a plane crash, we get inside the black box and we try to figure out what the pilots were doing and what kind of errors they made. Unlike the 2018 flu, which we've all forgot about, let's hope that we will continue to dig into this black box. So I guess the first place to start is, David, you had no intention of writing a book like this. You were working on something else entirely during the pandemic. And at what point did you decide, hey, I got to start taking notes and maybe write a book about this?
I would say probably I started poking around on my own pretty early because that's just my disposition. Anything going on that's really of interest to me, I tend to start digging on my own, which can go so far as I'll just start emailing random scholars or professors, about whatever it is. So I'm just one of those people. And I would say 9 out of 10 times people are usually excited to speak with you or whatever. So,
wait, hold on. You can't just say you're one of those people. You were a fact checker at major publications for many years, right?
True. But I would just say, just for the context that I often am digging into things where if I see something in the news that's of interest to me, I will, if I see something of interest, I often will start researching it on my own. And that often will include reaching out to, some sort of expert, or plural experts in a particular field to try to gain more information. Again, not professionally. This is just because I'm a weird person and I'm always kind of curious about stuff. As a fact checker, and this is before fact checking kind of gained this sort of political valence, but years ago, 10, 15 years ago, I was at Condé Nast and, fact checking there, it was just, they had, back then, glossy magazines had massive budgets and they could afford a whole team of people who were just sitting there, what they call the research department, where you were just checking every fact. It's some travel article and the writer says he, took him X amount of time to get from, Rome to Sicily or whatever, then I go in, I'm looking at Google Maps. I'm like, that sounds off, but whatever it is. So any from the minute to something big. And, one of the core tenets of fact checking that I was taught, or that certainly that I employed, is that you never trust a media source that as a backup. That's never sufficient. It's because if something's in the New York Times, that is not sufficient proof that something is true. That you have to go to the primary source. So I'm very interested in primary sources. So in many ways, my book really is it's an epistemological kind of quest, and it's about media, because media, for most of us in society, acts as a filter. And for someone with my kind of background in fact checking, and also just my disposition, I'm always trying to go to the source on things. I'm never quite trusting. So fast forward, it makes sense that to me, well, of course, the largest public health intervention in our lifetimes, it would be insane if I wouldn't try to figure out what's going on. So I just very early on, as you noted, I was working on another book at the time, but the kind of master switch of society was pulled. I had two kids in elementary school at the time, and I'm observing what's going on. I wasn't like a COVID denier or skeptic or anything. I'm just like, what is happening? What are the actual data show for the risk to different groups of people? And then to me, the big thing is, what do the data show for how effective some of these mitigation measures are? And you asked kind of when I launched into this on like a professional level, rather than just kind of sating my own, curiosity. And it was, I live just north of New York City. And we were told, as I'm sure all of your audience remembers, we were told we have 15 days to slow the spread. That was like the official slogan from the White House. And the reasoning behind this was we need to prevent hospitals from being overwhelmed. Okay. So by the mid to end of April, you can look at the graphs for hospitalization rates in New York had dropped off a cliff. They'd fallen something like 50% toward the end of April, by end of April. I'm like, well, great. I guess the kids are going back to school. We did it. We achieved the goal. We were given a very clear mission. We have 15 days. We're going to slow the spread. We're going to prevent, this big spike in cases. Everyone can kind of remember the graphs that we were shown. If you didn't listen to instructions, there'd be a big spike and the hospitals could be overwhelmed. If you did and you stayed home, if everyone followed orders, then it would be kind of smoothed out and we didn't have to worry. Well, we did it. The hospitalization rates had fallen by 50%. Well, you know what happened next? They didn't reopen the schools. And I guess my own sort of naivete or something, like, well, that's weird. They told us we had 15 days and we did it. Well, now they're changing it. Now they're saying we need another 30 days. So that's what happened. And to my observation, there was almost zero sort of analysis or skepticism or questioning by the sort of prestige media when this happened. I mean, it's like frog in the pot isn't even the right type of metaphor here, but it's like people really need to think that this was an extraordinary moment where 2/3 or 3/4 of society was basically home, other than the, kind of first responder types and others who needed to be out there working. The schools are closed. This was a really extraordinary, a radical event in America. And they went from 15 days to 45 days like that. I mean, there was just no questioning. I'm like, they just added another 30 days to this plan. Now, I'm not saying that's wrong to add another 30 days, but where's this coming from? What is the reasoning? What's the evidence? And concurrent with this thing of seeing the cases drop or hospitalizations in the New York area drop by 50%, concurrently, at the end of April and the beginning of May, Europe started reopening a lot of their schools. And we can get into this, Gregory, but that's when things really changed for me. When I'm like, something's really off here, that my kids are still, basically sequestered in their bedrooms all day, staring at a Chromebook. My son was in 3rd grade. I mean, it was insane. This is a little kid. My daughter was in 5th grade. This isn't going to work. And why are kids in Europe going back to school? So that kind of set me on the path where I really wanted to dig in. And for anyone who hasn't already clicked the off button, on this podcast, I should say, I did not approach this as some sort of Republican or right-wing operative. I wasn't trying to win points with anyone. I just was trying to dig in and look at the evidence.
Yeah. Now, I remember I talked to a lot of my friends who were very supportive of the policies and accepted the justification for the policies without a whole lot of questioning. And I say, look, can you maybe say this might have been a mistake. And the typical response that I'll get from people, and maybe it's because it creates a little bit of discomfort, is, well, people were making decisions in the absence of information, and so they just had to do something, right? And I think the problem with that response is that, yes, of course you have to make decisions under uncertainty. Of course you have to make decisions under stress. But that stress gets alleviated at some point, and the uncertainty gets resolved as we start to get information and so forth. So I guess the question that I think all of us have is the same that a typical investigator would have, which is, what did they know and when did they know it, right? So at what point did we have good, solid evidence that schools were not a source of infection?
Well, a couple things there. One, and we can get to this later, which is the idea of thinking about how decisions are made. And I have a lot of my book. I interviewed a number of philosophers who kind of spent their entire careers thinking about the precautionary principle and what that means and what it doesn't mean. And so that to me is fascinating stuff about like how we decide what to do when we have limited information. But setting that aside, I wouldn't say that there's no infection, but rather that schools were not driving the transmission in the pandemic. In other words, like opening or closing schools was not going to be this master lever of controlling like how much transmission there was in society. And the problem is that many things make a sort of intuitive and superficial sense, and particularly within medicine. And I give lots of examples of this in the book. Decades ago, Dr. Spock, I think, very, very famous book, tens of millions of copies sold. His recommendation was you should have babies sleep on their stomach because that's safer. You can avoid SIDS by doing this. It just made sense. You think of an adult
who's based on any kind of RCT or evidence.
Right. No,
it was just intuitive, right?
Yeah. Yes. You can't RCT that. So, and the fact is he was wrong. It turns out it's a little counterintuitive, but actually sleeping on a back for a baby is not a drunk adult who's, choking on their vomit. Babies are quite good at clearing things out if they need to. And there are multiple, societies, other cultures where the babies sleep on their back and they had a far lower rate of SIDS and other, issues than they did in America. That's just one example of many, many examples that I give in the book, and 1,000 more that aren't in my book, of where something might make intuitive sense, but actually when you do science, when you look at it, it turns out what we thought might be the case, it turns out that the sun doesn't go around the earth. It looks like it does if you just look at the sky, but that's not how it is. So I am very sympathetic to people who are like, well, of course, closing schools is going to be beneficial. That makes sense. You have a bunch of snotty kids running around. That's the kind of intuitive, superficial reaction that a normal person would have. The problem is that intuition is wrong. And it's wrong for a variety of reasons. But one of the reasons we knew it was wrong in real time, because you were saying, what did we know and when do we know it? As I noted, a couple minutes ago, toward the end of April, the beginning of May, 22 countries in Europe, 22 countries began reopening their schools. Millions of children. This is not, a random one-room schoolhouse in the countryside of Denmark. Millions of kids, 22 countries started going back to school. Toward the end of May, the education ministers from these 22 countries met at the EU, and had a Zoom meeting or whatever. And they said, we've observed no negative consequence. There's no obvious negative. Here it is. We've got millions of kids in school. The schools are beginning to reopen. We haven't observed anything wrong. This was effectively just completely ignored in the American media. There may have been one or two places somewhere that covered it for a second. This was not on the front page of the New York Times. This was not covered on cable news. Now, you may recall at the time, we were told, this is the single, if not the single most or one of the most important things we could do. We've got to keep the schools closed. It's obvious that, this is what's going to cause tons of infection. Even if the kids are going to be okay, we have to worry about the teachers. Well, here it is. Lo and behold, we have the Europeans acting as our, effectively our guinea pigs. And they sent millions of kids back to school and nothing happened. And this was ignored. It was ignored by our media and it was ignored by our health officials. They met a second time at the end of June. They had the same determination. I ultimately covered one of these meetings myself in an article I had written, that spring saying like, whoa, this is like really important. But it was just didn't exist. It was as if, we were back 200 years ago and there was no such thing as the internet or phones or anything. And the news of what happened on the continent hadn't yet crossed the ocean. It's hard for me to articulate how bizarre of a circumstance this was, Gregory, that millions of kids were in school and this was ignored. Ultimately, when it was brought up, the New York Times, they would write an article as if, you're this sort of anthropological study in, Germany and France is, starting to send some kids back to school. Like, here's what's happening over there. But they never touched on the idea about why it couldn't happen here. And when that was touched on, we were given a long list of bogus reasons. And we can touch on that. And I thoroughly go into it in my book. So there were two things at play. One is real world, like empirical evidence was ignored almost entirely. And when it was acknowledged, even in a minimal way, it was dismissed with a bunch of really contrived reasons that were based, again, on the quote experts' intuition. None of this was based on any evidence or data. And indeed, it was the opposite of what the data showed, because they already had millions of kids in school. So it's not only like, we don't have good evidence for it, but it's worth trying. We didn't have evidence for it, and we have real world evidence against this. But nevertheless, we were told that this doesn't count. It's Europe. So that, to me, was the kind of original sin, if you will, where things had gone horribly awry in America. And we can get into it. A great harm was done to many, many children in America because of this.
Yeah, perhaps I can summarize your discussions with your local school board. It kind of went something like this: like, why are schools closed? Because we don't want to kill kids, right? And it's like, yeah, but kids aren't in danger. Okay, well, we don't want them to kill their parents. It's like, well, they're not going to kill their parents. Yeah, we don't want them to kill the teachers. Yeah, but they're not going to kill the teachers. Well, we want to make sure that people feel safe. And it's like, well, people will feel safe if you open. Well, we don't want to kill the kids. So it kind of seemed
Correct.
like the administrators, it wasn't so much about what the administrators believed. It was sort of, they were kind of covering their ass, so to speak. I mean, was there sort of some incentives that they had to avoid doing any real research or, making decisions for fear that they would be held accountable if anything went wrong?
Well, one of the problems when you think about decision making, in a hierarchical system is that in most of the country, governors really punted the decision down to the district levels. And this was often sort of framed as this is great. I'm giving local autonomy. We're going to let
Right.
the individual districts and schools decide. It was kind of positioned almost as almost like a quasi libertarian, sort of more Republican, small government. Let's let, the bottom up decide. And this was, Andrew Cuomo and whomever else, this was largely how they positioned it. The problem with that was, there were multiple problems with it, but the primary one was that an average superintendent, that they don't have any expertise in epidemiology, or some school's chancellor. They don't know what's going on. They're reliant upon state public health departments and on the federal government. So the idea that you were giving this like authority to local districts, well, what happened was, as most people know, well, blue school districts in blue areas, whether it's blue states or you could be like a blue dot within, I don't know if you're like in Austin, Texas, but, around you is all red, but you're in this blue dot. They there was no chance that they were going to open schools because things had already kind of like bifurcated in this, the good people on the left are, the more worried you are about COVID, the more virtuous, the better you are. It's the bad people are, are want things open, and, there's a variety of reasons for that. And, Trump, he only cares about the economy. He doesn't care about people, et cetera, et cetera. So it made it politically like impossible for all. And I highlight a few superintendents who had the courage, the will, the social capital to actually pull this off and to open their schools full time in blue districts. And they did it. But that's very rare because, the bureaucrats who run education are the type of person itself selects for someone who's kind of within the flow. These are not iconoclasts. These are not like leaders. And that's the problem. There is an absence of leadership. And it's something I find very interesting to think about, that you can have a kind of abdication of responsibility, but if you market it correctly, as like a Cuomo and these other people did, you market this abdication of responsibility of, oh, I'm giving you responsibility. Well, they were totally unprepared for that responsibility. They had no ability to really act upon that because they lacked the expertise, they lacked the knowledge, they had largely a community who already had very strong feelings in one way. The only way these schools were going to open was either A, which was extraordinarily unusual, if you had like very, very driven leaders who went against the flow and did it anyway, or B, if it was coming top down, the governor said, you better open. And that didn't happen in Blue America for a very long time.
So I think the book is also about how do people form these beliefs, right? I mean, it seems like very few people actually start off really trying to know something, right? They just sort of swim in a sea of information sources, starting with the media and then maybe listening to some of these public health people that are given some kind of authority, but very few people actually behave like fact checkers. I mean, it doesn't take a whole lot of work, I don't think. I mean, it's not for lack of time and effort. People had a lot of time on their hands. You can very easily access virtually any scientific journal, and it's not that difficult to find out what's happening in Europe. I mean, are people just lazy? Do they just not care? I mean, or are they just incredibly gullible? I mean, why is it? How do you explain the way people come to their beliefs?
I'm a little more forgiving than you are, I think, of like the quote unquote average person, because I think, there are so many things.
I'm kind of not thinking about the average person.
Oh, okay.
I'm kind of thinking about, I mean, I'm much more forgiving to ordinary people, but when it comes to my peers and colleagues,
well, that's something very different.
I live in a city that has probably the highest per capita percentage of PhDs in the world, but their beliefs weren't that much different from the average people.
When I came and did a talk in Berkeley, the joke that the host of the event said was like, he said, anytime I made a point about how people weren't following, evidence and all that, he said, including in Berkeley, home of like the finest public, university in the world. He just kept saying, home of the finest public university in the world. And these, and people behave like sheep in many regards. That you can have people who are very intelligent, who are very bright.
Look, if I picked a random neighbor and said, what's a p-value? Like they would know. If I picked my random neighbor and they
would
knew,
know, you're saying.
Yeah, they would know, right?
That's
they know
very
what a p-value
funny.
is.
Yes. So here's the thing that's very interesting. And I don't know, all the research into this, but just my sort of like anecdotal life observations that I don't think are particularly novel, which is there are different types of intelligence, and maybe that's not the right word, or different types of thinking or critical thinking. And there are plenty of people who have a lot of intellectual firepower, who are very good at thinking through certain types of problems or certain topics, but they're very bad at being critical thinkers. They're very bad at being independent thinkers and being able to kind of see outside of, the sort of typical kind of confirmation biases and outside of the sort of like motivated reasoning. So I think one of the things that's really important when we think about what is true and how decisions are made, on policies that affect all of us, is that we, or I should say society, and particularly people on this kind of like academia, generally on the left and the sort of broader kind of like sense-making institutions and, elites of our society tend to believe and go with sort of people of their same class. And that's a kind of like, heuristic almost, or a shortcut. It's like, oh, well, if the CDC is saying such and such, or if Anthony Fauci, oh, this guy, Donald Trump is an odious, unserious, like dangerous person. This guy, Anthony Fauci, he's been around for decades and decades. He seems reasonable. He's like me. He's an academic. He has advanced degrees. He's like, whatever he says, I'm going to go with him.
It's ad hominem, basically, right?
Yeah. The problem is that so many people tended to just go with their tribe. They didn't actually look at the evidence. They didn't want to look at the evidence. When they were presented with contrary evidence, they dismissed it. This was I think most people have such a deep human kind of need to be part of their group that human desire of like not wanting to be cast out of even in their own mind, even if they had like that, it's not even about like they had a different thought and they wanted to suppress it, although that happened, we can talk about that, but rather they didn't even get that far to even have a conflict in their own mind. It was like just out of hand dismissed something that went against the smart people. And that's incredibly dangerous. Particularly, look, we sometimes you have to go with an expert. If I'm going, to get my car fixed, like I don't know enough about that, I'll just let the mechanic do it. You cross your fingers. But there's a reason why if you go to, you bust your shoulder and one orthopedist tells you need surgery, you might get a second opinion. There's a reason why that phrase and that thing exists. It's because experts disagree at times. And one of the problems that I tried to explicate a lot in the book is that there really was a false consensus. It was manufactured. It was an illusion of the experts say ... This happened over and over and over again in the New York Times on down, where they quoted the same short list of people, many of whom, by the way, had no particular expertise in infectious diseases or in, how to mitigate them. This person, Megan Rainey, who now got rewarded for being, in the news constantly, she's now the dean of at some school of health at Yale or Brown or something. Yeah.
And there's one
she's
person I think who was...
Yeah,
there's one person who I think you said was quoted all the time, and she had she had diagnosed with OCD.
Constantly, some of these short list of people with no particular expertise in these things, but they had no problem being the, pundit on speed dial. So you have that going on. And the other thing is that once I started writing some articles that were challenging the sort of consensus view or what we perceive to be the sort of like accepted establishment view, and I was writing them in publications that were part of the kind of establishment, even though I was going against the establishment.
I remember Wired. I remember reading those
That's right. And that's where I began doing a lot of these pieces, Wired. And then ultimately I wrote a lot of pieces for New York Magazine, for The Atlantic. I even wrote a piece in The Times, although that piece got neutered before it came out, where I actually had, I'd interviewed some physicians who had written something for, I forget which journal, but, pediatrics or something like that, where they were highly critical of the school closures, and the New York Times just blackbarred the whole paragraph. They took it out. I mean, it was true. I interviewed these guys. This was in a respected journal, and they were like, we don't think this makes sense. This is a good idea. They just blackbarred it, just took it out of the article entirely. So one of the things that people don't realize or didn't realize at the time is that once I started writing these articles, people from around the country started contacting me, including a lot of physicians, including those who are at, top university hospitals and other elite institutions. And they would say, thank you so much for writing this article. I agree with you, whatever the specific topic was of the article. I think schools should reopen. There's not good evidence. This is beneficial. You made a really strong case for this. Or, I don't think masking, 3-year-olds is really going to help and it's probably harmful for them. Whatever it may be. I'd written a whole bunch of articles over time, and they would write to me and say, but all of this is off the record. Don't mention my name. Don't include me in your next article. But I just want to thank you. But I can't be quoted on any of this stuff. And there were a few of them who volunteered and told me that point blank, they were explicitly told by the, head of their department at whatever university hospital they were at, or ever, saying, you are not allowed to publicly go against the CDC or Anthony Fauci, what they're saying. You can't do it. And one of them got reprimanded for doing so, for giving an interview where she kind of had, she was just citing data. It wasn't even her opinion. So what is this sort of environment that's created is that the average person, including the average academic, they're like, what? When I start reading the New York Times or turn on, whatever, NBC News or whatever it may be, I'm not seeing any voices of experts saying otherwise. I'm seeing these people, they're saying we have to do this. It's not safe to open schools. And if you want to open them, you need to have 6 feet of distancing. Everyone needs to be wearing a mask, whatever, we need HEPA filters. And I have a whole big section on HEPA filters in my book. They were like, we can't open the school until we get HEPA filters. It's unsafe. All of these things are like, okay, this is what the experts are telling me. So, but there are all these other voices, either self-censored or were explicitly censored. So you had this very distorted perception of what the quote expert class really knew. And one place we can look is Europe. You don't even have to interview them. You don't even have to get a statement. The schools were open. And that wasn't because the education departments of 22 countries went against the health experts in their countries. The health experts said, go ahead and do it. We think this is the right decision. Well, how is that just completely dismissed out of hand? Like, one of the things, and I still get animated about this now, one of the things that I think is so mind-blowing and fascinating is we were in this circumstance not that long ago that most people want to just memory hole. And there are these different kind of very convenient, exculpatory, post hoc narratives, that have come out. We did the best we could. 1 million people died. Of course, as if that somehow has any relevance to whether a mitigation thing worked or not. How many people died is not that is unrelated to whether or not this particular intervention would or wouldn't be effective. So you had this thing where all of these ostensibly really bright people were not thinking. And they were ignoring information that was staring at us in the face. And you had this, to use that word again, you had this epistemology of where we favored theory and opinion over empirical evidence. That is a wild circumstance. And it's one of the reasons that I felt motivated to spend years writing this book and just painstakingly trying to create a document. So I'm hoping that, if I'm not too big for my britches here, I hope in a decade or a couple decades or more from now, people will look back at the book and use this as a tool to understand how does something like this happen where science and evidence is ignored. And not only is it ignored, but it's ignored by the people who ostensibly are the experts who should know better. I don't spend a lot of time criticizing Trump or, Alex Jones or conspiracy theorist people because that's boring. I don't expect them to know what's going on, but I do expect people with advanced degrees. I do expect physicians. I do expect these public health experts. And my book in many ways is a study of how those people, it's the failure of the expert class.
Well, maybe the book will, like Graham Allison's book about the Cuban Missile Crisis, maybe even
right.
Nobody cares about the Cuban Missile Crisis anymore, but they're still interested in the insights around the decision making.
Right.
But look, to what extent is it something to do with the fragmentation of expertise, right? Because, the epidemiologists, of course, they're, to them, as a hammer, everything's a nail, right? So they see their role as disease containment. And their excuse is, look, that's my job. That's my role. That's my agenda. And if you're worried about the cost to society because of loss of education or whatever, that's somebody else's job. And, they can argue the harms and I'll argue the benefits. And then it's somebody else's job to figure out how to integrate these things. So to what extent is it that we I don't know, decided that this one tiny subgroup of experts, we're going to kind of hand them the keys to the car.
It's such an important point that you make, with your question there, which is that these decisions we were constantly told. You remember the phrase Andrew Cuomo, said this frequently, which I recite in the book. How he says, like, you follow the science, you follow the data. It's that simple, And this was very comforting to the average sort of like normie, liberal elite type person. Yeah, I've got this psycho in the White House. At least we've got this guy. He's serious. He's into science. Who's going to disagree? And all the people with third lawn signs, probably had a bunch of them in Berkeley. In this house, we believe in science stuff. Science doesn't tell you what to do. Science is a process. Science can be information gathering. There's no such thing as we'll open schools by the science. What does that even mean? It means nothing. Opening schools, or whether or not a 2-year-old should be forced to wear a mask, all of these things relate to values. And when you need to weigh the costs and the benefits, or the theoretical benefits, because we weren't even weighing the benefits, because the benefits weren't there. And I think I give an extraordinary amount of evidence to show that the benefits over time were not there, that closing schools and a bunch of these other things may have had a beneficial effect for a very tight window of time when everything else in society was closed. After that window of time, mitigation measures simply are not effective. And there's an enormous amount of data to show this. And we knew this before the pandemic. There was a very interesting study from Robert Barrow, forget the journal that was in, the Bureau of Economic, whatever it's called. Anyway.
NBER, I think it was.
Yeah. And he looked at the 1918 pandemic, and sure enough, like, there was no correlation between cities that had schools open, right away versus other ones that kept them closed for a real long period of time. No correlation at all between, the overall, disease burden in those communities, or in those differing cities. So we had it from the past. We knew it from the present. And this, again, was ignored. And it's such a fascinating thing how real empirical evidence is dismissed and ignored because it doesn't fit someone's like narrative that they've described to themselves in their head, and that continues to get described to them. And in part, this became so politicized, as I mentioned, this sort of like, if you think a certain way or behave a certain way, you are a good person. And if you are a mom and pop business owner and you're like, you know what, I'm making this, I'm 37 years old, I'm healthy, I don't believe I'm at great risk of the coronavirus, but I'm about to go bankrupt. I'm burning through my savings, paying for my mortgage. I'm not bringing any income in. But you're a piece of garbage if you wanted to open your store up and get people in there. I mean, this was the way that everything was positioned. And that person, by the way, who owned the store could have been a Democrat for their entire life. Didn't matter. You were a piece of crap if you wanted to do that. You were an immoral, bad person. And again, this is about values. Different people are going to have different values about what's meaningful to them, number one. And number two, that even presupposes that the evidence suggests that there was a reasonable trade-off. And none of the evidence actually showed that. So we were sort of like multiple steps removed from a reasonable discourse and a reasonable sort of information environment about this, in my view. And that's the picture I try to paint in the book, is how there were like layer upon layer of these things taking place that just distanced ostensibly bright, thoughtful people from dealing in reality that was actually around them. Instead, they were gripped by fear and gripped by a sort of, tribal belief system and a desire for belonging within their group. And that overrode any sort of independent critical thinking and reasoning.
Yeah. Now, the thing about fear is that, one would think the fear would subside at some point, but it seemed to be kind of continuously, reignited, by the media. And in particular, I mean, the New York Times. I mean, I've been a New York Times subscriber for, most of my life, right? And I was extremely disappointed by them because that's an institution which I think most of us put up on a pedestal, right? We think of it as the pinnacle of high quality journalism. But I was extremely disappointed, and I couldn't figure out why they had gone the way they went. And so just the other day, I was trying to figure out why, and so I looked it up, and I said, how much value did the New York Times acquire during the pandemic? And the value of the New York Times went up 60%. I mean, this is
Incredible.
many, many billions of dollars, right? Like
Mm.
$4.5 billion was the increase in their valuation. And then it sort of made sense to me. And I don't want to be cynical. I mean, I'm an economist, so I guess I'm supposed to be, right?
Right.
But generally, I'm not. I mean, I don't think that any of these journalists were mendacious. But I mean, is that the simplest explanation?
I think it's easy for people to say things are about money, and that may factor in on some level. But the desire to belong, the desire to kind of the delicious. I mean, you can see it in the New York Times every day. That now I'm just so hyper aware of it. But this sort of like kind of like relishing. You could just see the pleasure of kind of dismissing and putting down one's adversaries or perceived adversaries, the bad people. It's just like dripping off the page or off the screen. And, my book is filled with what I would essentially like refer to as case studies of a series of very important, influential New York Times articles, some of which directly led to schools remaining closed. I mean, there were people in different cities in America who were trying to get their schools open. And then someone on the school board said, well, this recent New York Times article that just came out, that's it. We're not opening. It said such and such. And what I show is that over and over again, these writers for the New York Times, including some who, Pulitzer Prize winners and whatever, that everything in these articles, or almost everything, was an argument from authority. It was, they quoted someone saying something, well, we need HEPA filters in schools for them to be safe. And they never put any freaking evidence. They never actually either questioned the expert who they were quoting in the piece. Oh, you say we need HEPA filters. Okay, that makes sense. Well, what kind of studies show this? What's the evidence behind this? Or if they didn't ask them, they didn't do any investigating themselves.
But
And
I mean, does that represent a change? I mean,
I
for
don't
me,
know if that's
the idea
always been
that
the case or not. I think in many instances, reporters are very keen to press someone in power about, well, where are you getting this information from? Or they want to investigate on their own, but they have to be motivated to do that. And this wasn't the Defense Department. This wasn't the church. This wasn't big business. These are the areas that a lot of typically is sort of mainstream, normie, liberal journalists at the Times or elsewhere, of which I used to be, a part of that clique for many years, that those are the things that motivate them. Yeah, we're going to stick it to them. They can't just make this claim. We got to find out if that's true. That skepticism evaporated in the pandemic. So you have these lengthy New York Times pieces just larded with quotes from the same 5 people, again, like some of whom, like Megan Rainey, had no expertise at all, yet were presented as an expert. And I don't care what an emergency medicine physician has to say about this. I mean, fine, she's welcome to give her opinion, but she's not an expert in this field of study at all. But yet she's opining on this. So whether it's someone who had no expertise, or even if it was someone like a Fauci or whomever else who ostensibly had a knowledge of this, they didn't ask for evidence and they didn't investigate it themselves. And there are other times where they didn't even bother getting a quote. It just said, experts say, ... I mean, this is just the lowest form of knowledge creation. This is just a deep, deep disservice to Americans. And the harm is that, it's easy for people to pick on like Fox News or something, or Alex Jones or whatever it is. But that's again, I mentioned before, that's boring to me. That's not engaging. What's harmful is when you have somewhere like the New York Times, these are very smart people, that it has the veneer of learnedness, of reasonableness. They know how to write an article. It has the right type of narrative flow. It's using sophisticated language. It was copy edited, so the grammar and the punctuation, everything there. You're reading this, it's like a person's going to come away like, this is a reasonable presentation of the evidence. But the people weren't taking that extra step and saying, there is no freaking evidence in here. They're just making statements. And expert opinion in the higher, there's like a triangle, a hierarchy of evidence within what's known as EBM, evidence-based medicine, about how we make decisions on which medicines and therapies to approve or to, prescribe to patients, or which types of policies to put in place. In the hierarchy of evidence, expert opinion is at the very bottom. At the top, you might have randomized trials and then blah, blah, blah. And those aren't perfect either, but expert opinion's at the bottom. Yet that is what all this was hinging on in America. And while we ignored in real world empirical evidence from elsewhere, and then ultimately ignoring real world evidence at home as well. This was known in real time.
But inside places like New York Times, were fact checkers sort of sidelined? It's hard for me to believe that Marie Claire and Vogue had better fact checkers, in the 1990s than New York Times did in the 2020s.
But here's the important part. You can write an article that's fact checked beautifully. There are no mistakes in there, and the article can still be wildly misleading. If you think about a photograph that shows someone, with like a fist to their jaw, and it's like, oh my God, they're getting punched. But right cropped outside the frame is, someone else with a gun to the person's head who's punching that, whatever. It's a bizarre scenario. But my point is, fact checking isn't necessarily the correct tool for the appropriate presentation of reality as it exists. So a bunch of experts giving their opinion, yes, that should have been fact-checked. And there were plenty of outright falsehoods told in many of these articles and many of these news reports, but there were plenty of articles that weren't necessarily false, but they were wildly misleading. And that's the danger of someone being like, oh, well, this thing is fact-checked. But it doesn't matter. They didn't present all of the facts available. They didn't investigate. This was just someone giving their opinion.
Right. So in other words, if they do a feature on a kid who dies, right, from some COVID, disease, right, with immunological thing, and they highlight it, and then they forget to mention this is like a 1 in 100 million sort of event. The failure to mention the low probability of this occurring would be deceptive, but there was no false statements like this kid really did die of this
That's correct. Right? And one of the things I talk about in the book is the phenomenon of the missing denominator. And it's like over and over again, they would have some article, a school in Georgia opened and there were, 22 cases in that school and they weren't wearing masks. Oh my God. And everyone's like, see? Well, what they didn't talk about was that there were 50 other schools open in Georgia where nothing happened. And maybe there were hundreds of others where nothing happened. And by the way, then you look at the example I'm giving is real, and I talk about in the book. And then you look at Georgia and the case rates in the different counties and different regions, including regions and counties where schools remain closed, were no lower than the areas where the schools were open and the media and everyone else went ballistic, and feeling so, oh, I'm so virtuous. I'm such a good person. Those assholes, those fools in Georgia opening the school. Those ignorant Republicans. I believe in science. I'm a good person. Well, they forgot to look at the rest of the state where schools, in other areas where schools weren't open. And guess what? The case rates in the community were the same. It did nothing. So they left out the denominator. There was all this focus on the numerator, on let's find these specific places where an event happens. There's a child where it's thankfully very rare. They had this horrible outcome from this, what they called Miss C, MIS-C, MIS-C, or it was kind of like a Kawasaki, inflammatory syndrome. Thankfully, this was incredibly rare. But they highlight that, you have a recency bias, or they go, and again, they're ignoring the denominator of 50 million kids who didn't get that. And they're ignoring the denominator of hundreds, if not thousands of schools where nothing at all happened. You're always going to find a school where there's some sort of outbreak. And by the way, half the time the outbreaks didn't originate in the school. They may have originated outside the school, but they called it a school outbreak. In the same way that the crime rate in a city can fall over the span of a decade. But on the nightly news, at least, when I was a kid growing up before there was the whole news ecosystem, you still could have the same 12 minutes every night devoted to a murder. Even though the overall crime rate went down, there are enough people in a giant city, you're going to find a murder every week. No problem. You'll find a new murder to talk about. That is focusing on the numerator without providing the context of the denominator. And that happened over and over in the way that the American media covered what was going on. And the expert class of public health professionals went right along with it.
Well, I mean, I think I'm like you, that whenever I read something like that, I'm immediately asking that question. It's like, okay, so, we need to convert this into a number that makes sense. And I used to think that most people did that, and I realized nobody does that.
No, there's
it
this innumeracy of the public that's, and you're an economist. I mean, I talk about all the time in the book of these second order effects that they didn't think through or care about this sort of cascade of consequences from doing these things. And it was positioned as, well, do you want to die? Do you want teachers to die? So when you position it in that way, everyone's like, well, I don't want anyone to die. Let's just do this. But of course, that was an entirely erroneous type of framing of the questions around policy. And they didn't think through all these second order effects, including, by the way, besides all the harms to children, which were immense, and we're going to run out of time to not even get into them, but including thousands and thousands of hundreds of thousands of people most likely missed cancer screenings, didn't go to the hospital. There were multiple studies that were done. Kids or others who had appendicitis didn't go to the hospital until it already reached an emergency stage where they could have been treated earlier, but everyone was so afraid of going to the hospital, afraid of what's going on, that there was more harmful consequences from a whole variety of diseases and trauma and things, such as, again, skipping cancer screenings for years because they were afraid. There are very serious second order effects when you start tinkering with the gears of society at this level. And that's, sure enough, that's what happened.
There's a lot of evidence that education deficits lead to shorter life expectancies.
Of course,
and so
extraordinary.
So if you have 50 million people who have their education impaired, then that's 50 million people whose life expectancy you've impacted negatively.
There were kids who simply disappeared. It's not even, we have tons of evidence, which is worth looking at, about, quote, learning loss and how these kids, and it's directly correlated with the time they were out of school. There are some studies and people said, no, if you look at it at this state versus that state, you can't look at it at the state level. That's too crude. When you look at a guy named Vladimir Kogan at Ohio State, amongst others, looked at it at the county and at the district level, there is no ambiguity. The more kids were out of school, and this shouldn't be surprising, the more kids are out of school, the worse they were performing, the further behind. And guess which group of kids fared the worst? Who suffered the worst consequences of these long-term closures? Poor kids and Black kids. The very groups that liberals and the left, purport to care about the most. And this is the thing, this sort of, moral injury for one to actually come to terms with the fact that, by advocating for these closures, I caused harm to these people unnecessarily. The very people who I think that I'm the person who's a champion for them. It's an incredible irony, and one that's really important. Again, I think yet another thing to really examine. I understand why people don't want to accept it, but it's very important to know this was not simply, well, we did the best we could. We were building the plane as we fly it, and all these cliches. It was a fog of war. None of that's true. It's just simply not true. The evidence was there. It was abundant. it was ignored or it was dismissed away over and over again.
Well, it seemed like a critical moment in this history was when Trump tweeted out, "Open the schools." I mean, that really seemed to create a lot of damage. And I think the American Pediatrics Association, right after that, flipped its
That's
position,
correct.
right? And then they said because of new evidence and new data, but there was no new evidence, new data. The only new piece of information was that Trump had come out in favor of opening the schools. I mean, that seems to be the most disturbing fact in the entire book, because the pediatricians are supposed to be, I mean, the notion that there is, you know, a democratic medicine and a Republican medicine, I mean, if you told somebody there's a democratic biology and a Republican biology, or democratic physics, and I mean, how did we get to a place where the physics and the biology and the medicine that you practice is a function of your political affiliation?
Unfortunately, most physicians and people in public health it's so uniform in its political leaning. Not all
Yeah,
of
but
it,
so
but it's
what? Like, that shouldn't matter.
no,
Like, I
it
mean,
shouldn't.
your
But
plumber's going to fix your sink the same way, regardless of whether they're
but
Republican or Democrat, right?
the political leaning and the uniformity of that creates an environment, and most people, and again, you think about the
So it's like
self-selection.
more important that you express your tribal affiliation than that you save
Who
kids'
goes into
lives? Like,
medicine?
that's crazy.
Who goes into medicine? It's someone who got straight A's in high school, most likely, got straight A's in college, then went to medical school, then they're doing their residency. And what happens in your residency? You listen to the attending, you follow orders, you memorize decision trees about what to do. All of this self-selects for a certain type of person who's smart, who works hard, who's motivated. Those are all really good and important things, but it also selects for a type of person who's not going to confront those who they may disagree with. You're not encouraged to challenge the attending physician when you're a resident. They know more than you. You're not encouraged. You didn't become successful and, making whatever, 750 grand a year as, an orthopedic surgeon or whatever it is. You didn't get there by like being an iconoclast, by doing something. You got there by following the rules from day one. The type of people who tend to go into medicine were really good students. How do you get straight A's? Yes, some of it is if you're just smart. But in order to get at that level, it's because you follow the rules. You're not going to question people generally. I'm drawing in broad strokes here, but I think there's a strong thing about who these fields select for. And many of those traits are really good and valuable traits in a physician, but some of them are harmful in a circumstance like this. So, and sure enough, the American Academy of Pediatrics was very much in favor of schools opening. And indeed, that one of the head people there, either in their statement or in an interview following it, had said, don't worry about 6 feet of distancing. There's not really good evidence this is any better than 3 feet. Or if there is, it's not worth it. Get the kids in school. I mean, it was unambiguous that this is the position of the American Academy of Pediatrics. Very shortly after Trump did his tweet in all caps, open the schools in the fall with a million exclamation points, boom. They switched the guidance. Gone was the idea of don't worry about 6 feet of distancing. Gone was the idea of get the kids in there no matter what. And instead, they said, we need a lot of money and you need to listen to the experts. So, I mean, it was just so baldly political. It's so disturbing. But that AAP thing really is just kind of emblematic of the broader dynamic that took place. And, you touched on, you were asking a while back about this sort of narrow range of expertise. And, a pediatrician, let alone like Anthony Fauci, they have a particular mandate of a particular thing they're looking at. They don't have a wider scope of a more panoramic view of what's going on. And, there's a person named Emily Oster, who's an economist at Brown. I feature her in my book quite a bit. She took it upon herself to just collect data. Was this a proper study in many instances? Absolutely not. But in the absence of any data at all is better than zero. She said, let me just try to get something because the government isn't doing jack shit. States aren't doing anything. I'm going to do this and just do it on my own. And it's funny, I was at a party with, there were a bunch of New York Times people there. This is like a couple years into the pandemic, or maybe after it already kind of wound down. And Emily's name came up, and the New York Times editor, she said, I'm not going to listen to Emily Oster. She's an economist. I'm going to listen to an epidemiologist. And I'm like, you're a moron. Like, that's the problem. You need views from other people. Economists actually have a lot to say about this. They understand the data. They're looking at second order consequences that an epidemiologist might not know about or think about. Anthony Fauci, by the way, has zero expertise in masks and understanding the literature regarding mask mandates. He doesn't know anything about that. He doesn't know anything about HEPA filters. He doesn't know anything about 6 feet of distancing. He has no particular expertise in any of those things. And yet he was deemed the sort of director of the entire response in America. Him and Deborah Birx was the same thing. They didn't know anything about this. They may have had, so when you talk about narrow expertise, it's actually far narrower than you may think. That it's not even like, he's not even an expert in this. So he had a very particular area of knowledge, but yet he then ran the show for America. And he said, he was asked about, the economy or something. He said, I don't know about, those economic things. That's not what I do. Well, economic things have a lot to do with health. So that's the problem, is you just have a very small number of people with particular areas of expertise, oftentimes misrepresented, and they directed the entire response, and all sorts of other voices were completely shut out. And that's deeply problematic in decision-making.
I don't care. I mean, generally, the fragmentation of expertise is not a problem if it is distributed sort of evenly and they all have a voice. But it seemed like there weren't any voices that were advocating for the children. So, yes, you might have infectious disease specialists, and their one mantra is like, let's reduce disease transmission. But on the other side, you would need people who are like, hey, let's reduce information, let's reduce education loss, right? And so one would think that the people who would be in that position would be the teachers, right? So, you would imagine ex ante that you would have the infectious disease people over here saying, do everything we can to eliminate diseases, shut down schools. And then on the other hand, you have these educators who would be saying, let's do everything we can to keep people educated, and right. There would be some balance. But the teachers wound up being the biggest advocates for school closures. Now, that to me was probably the most shocking aspect of this. So how did the teacher unions wind up on the side of keeping kids uneducated?
Well, the teachers unions, in my view, were merely opportunistic. And, again, this comes back to the idea of a sort of political tribalism. And I mean, I quote from it in my book. When you look at the Los Angeles Teachers Union, I mean, they put out essentially a manifesto, just a wild, fantastical thing where they have demands of, we want rent-free for people, and we want a special tax on millionaires, a different tax on billionaires. We want to defund the police. We want things that had nothing to do with opening schools. Yet this was in their demand list in order for schools to reopen. And I think many of them admitted publicly, saying, like, this is our chance. We're going to use this leverage. This is our chance to really, let's not just reopen schools eventually. Let's do it in a new world. Let's remake the world. Let's change things. So you have these teachers unions at times just making outlandish demands that had even no basis in safety for anyone. Defunding the police or whatever had nothing to do with the schools or special taxes and whatnot, and eliminating charter schools and on and on and on. It's quite a wild document. I recommend people look at it. It's just like such a crazy kind of sort of like record of that moment. So you have teachers unions, I think, being opportunistic. Some of them, I'm not saying all teachers were like this, but the unions by and large were. But my critical eye goes ultimately back to the public health leaders, because the teachers unions never could have pushed for any of this stuff had the public health establishment been honest about what the actual risks of school were and what the actual limited or lack of evidence of any benefit of closing the schools. You didn't have public health leaders coming out and saying publicly, look, these teachers unions, you're wrong. Like, I understand you're scared. You shouldn't be. Sweden never closed their lower schools. And by the way, Sweden, Stockholm is a densely populated city. They had more than 1 million kids in school there. And they saw, sorry, Greg, I'll stop and say, they saw early on the teachers had no higher risk of outcomes of COVID than the average professional. And they never closed their schools. The teachers are like, the evidence was copious from very early that opening schools was not putting anyone, including teachers, at any graver danger. But the experts never went ahead and actually voiced this in America. So therefore, it gave the teachers unions, they had the whole open field to run with this thing. And that's exactly what they did.
Yeah, and of course, that information was available. I saw that, you saw that. But, these teacher unions, the leaders, were on the record as saying like, a couple of years without school, kids will be fine. And it made me think, well, wait a second.
Like, maybe you're not so important.
If what you're saying is that kids don't need us teachers, then why don't we just abolish public schools altogether? I mean, if it's not necessary, it's a very expensive thing.
It's not an unreasonable reaction. I mean, someone, I forget who, probably more than one person has said, the way the teachers unions behaved during the pandemic, you would think that this was like a Republican sort of psyop, that it's hard to, they could not have done more damage to themselves. If someone, no one else could have done this more than they did on their own. It was so damaging.
But you had public school teachers saying, hey, public school has not been around for that long.
Just wild stuff that really, really harmed people's belief in them. And I get into this in the book. There's interesting stuff about what is a professional's responsibility to themselves and to society, and what does it mean to be a professional? You can go back to the kind of medieval era, and you think of the professionals and what they owed to their village and how the communities interacted. You can't have it both ways. You can't say that that school is an essential service, that you are an essential worker, but we'll keep it closed. You can't do both. And what I talk about in the book is that, look, we have a circumstance where what we used to think was a fundamental right for American children was to get an education. And there are many problems with our K-12 education in America. There are many inequities. But keeping the schools closed did not resolve any of those problems. They simply exacerbated them. So I'm not making the case where, because some people have argued, well, things weren't good before. Sure, that's true. But the idea that keeping schools closed was going to remedy any of that was, of course, a farce. And indeed, it made these differences between different districts, wealthier districts and poorer districts, wealthier students and students with less. They just simply amplified all of those differences and set the kids who were underprivileged further and further away from their peers who had more advantages. So all on so many levels, there was just this disingenuous and very harmful kind of car on cruise control, just veering off the highway, that we were all just stuck in the back seat of this thing. And the shame of it is that it didn't have to be this way. We see plenty of other countries that had the same data, the same evidence that we had, and they behaved very differently. Far more, they made mistakes too, but far more sober and prudent in how they conducted themselves. There is something unique in America in this dynamic, and I'm worried about it because this sort of reactionary politics and reactionary belief systems on the left, on the sort of elites, on the academics who we're supposed to believe in, those are the people we're supposed to trust, that their behavior has really, it should be no surprise to anyone on the left why half the country is pissed at them and hates them and doesn't trust them. None of this should feel surprising. It is incredibly alienating and condescending the way that a significant part of the country behaved and conducted itself. And that's not ultimately going to get us to anywhere positive. And I had people, I was one of the first journalists to interview this guy in Israel who was the initial physician to spot the signal of myocarditis in young males, predominantly from the vaccine. This is just true. It was just a fact. It happened. Doesn't mean the vaccines aren't all bad or anything, but I'm saying this was a genuine adverse event that was occurring, and it was real. And I remember talking to a pediatrician in my town who I think I saw her at like the dog park. I said, hey, I hadn't written about it. I said, I want you to know, like, I spoke to this guy. He's like the head of blah, blah, blah in Israel. Myocarditis, this really is like a signal. And she said, I hope you're not going to write about that. She's like, that's just going to feed into the anti-vaxxers. I'm like, but it's fucking true. Like, and so that's the problem, is that like everything encapsulates in that woman's response to me was, yeah, but that's going to feed into the bad people. You can't give any ammunition to the bad people. So that is anti-intellectual. I'm sorry, but you just cannot conduct yourself in that manner. And I tried not to do that. Again, I had no like desire to win points for one group or another. I tried to just follow what the actual reality was.
Yeah. Well, you also write about modeling quite a bit in the book. And, I teach modeling in all my classes, and there's nothing wrong with modeling, but models are built on assumptions. And so one of the exercises that we learn in any introductory business school class is like when you put together a model, you explicitly state your assumptions and you rank order them from, biggest impact to smallest impact, the ones that you have the least about to the ones you know the most about. And then that provides you with a research agenda. And so immediately, you go out and try to validate the assumptions. And you point out that very little research was done on the assumptions that lay behind a lot of these models. And, given the amount of money that we spent, given the amount of trillions of dollars we spent, wouldn't it have made sense to set aside just a little bit to kind of validate some of these assumptions? What happened there?
I spend a lot of time talking about models in the book. I think it's an incredibly important part of this story. I'm sure you and your students and stuff are familiar with GIGO, garbage in, garbage out, and the model is only as good as what you put into the model. Number one, and number two. And I interviewed some really interesting people, as philosophers of medicine, who actually have like a particular focus in modeling. And they make a point, which is, fairly banal, I guess, but important nonetheless, which is the people who make the models get to decide what is important and what's not important. It is not an accident that the models that guided the pandemic response were like on hospitalizations and deaths. They did not have parameters put in there for like child misery, for school loss, for learning loss, for eating disorders, for missed cancer screenings. All that wasn't in the models. So what they had, it's quite important to note that the people who made the models also tended to be the people who did the best in the pandemic. That's what this guy Eric Winsberg, philosopher who I interviewed, that's the statement he pointed out to me many times. Like, boy, that's pretty ironic that the people who chose how to create these models, they were the ones who were in comfortable homes. They were the ones who had their kid. They probably had one or another parent at home with the kid to help them with their studying. Maybe they could pay for a tutor. Maybe they went to their vacation home somewhere. If the people designing the pandemic response were in a studio apartment in the Bronx with, 4 children, with one absent parent, and with one of the kids is sick, and has a learning disability, I'm pretty darn sure that their recommendations would have been quite different if those were the circumstances they were living in. So a lot of your listeners, whoever is still here, audience right now at this stage of the podcast segment, that who are in academia or aspire to be in it or whatever, that their experiences were very different from millions of people. So they're like, what's the big deal? This makes sense. Yeah, it's better to just be safe. It's better to do this. Well, that's for you. it's better. It's not better if you're the guy with the mom and pop store that's going out of business. It's not better for the single mother in the Bronx in a studio apartment whose son is going to be a senior in high school and was counting on that football season to get into college. This was this kid's ticket out. And I interviewed a guy who runs a football program for at-risk youth in the area. And he's like, these kids, their lives are permanently altered. That scholarship to college, that's gone. None of that shows up in the statistics necessarily. It doesn't show up in the learning loss. It doesn't show. These things you can't get back. So for them, that their value decision is going to be very different from the people who made the models. I could go on and on about the models. It's so, it was to use a cliche, it was like a house of cards. Most of the data that were in them and I dig down and down and down, as I'm sure you know from reading the book, that it's like, I'm like, oh, this model makes this claim about, transmission in schools is X%. I'm like, okay, well, where'd they get that from? I look at the citation. All right, let me click on the citation. This must be the study where it shows that. Oh, well, the citation just took me to another model. Okay, well, let me read the citations in this model. Well, that took me to another model. And it's just, and I likened it to the Russian dolls. You just kept opening. There was just a doll inside of a doll inside of a doll. Until finally there was a thing in the supplement where it said, we've chosen this number arbitrarily.
We made it up. Right?
I mean, people would not believe me. I mean, that's why my book is filled with endnotes, hundreds and hundreds of endnotes. I try to back every single thing up in there. So if someone thinks that this is too outlandish, just go. I give all that. You can, click on all the studies and you will see what I'm talking about. And you'll see the American Academy of Pediatrics filing an amicus brief against, in favor of mask mandates in Texas. And part of their argument was that when children see adults wearing sunglasses, that most of the time they can tell what their emotions are. So a mask really isn't any different from sunglasses. Therefore, there's no harm. There's no disadvantages of adults being masked in the school. This is what the American Academy of Pediatrics was arguing in a court brief. I mean, this is like so nuts. So all of this stuff it is so fascinating to me. I think it's really important, as you noted, stop. This isn't about the pandemic. It's about how do societies behave? How do individuals think and behave? How do people in power think and behave? And I try to really pull the lens back and I go through history when you're looking at sort of, who are, John Locke and David Hume and people like, how do we develop this idea of empiricism? What does that mean? And going through what does it mean to have responsibility to others in society, and kind of like walking through what is an evidence-based medicine and so on, to try to the book is really me trying to figure this out. And that's where I take the reader with me. It's like, how did all these things happen? I try to show how the gears of society turn behind the scenes. It's not just a cataloging of this happened, then that happened, then that happened. It's like, well, this happened and that happened. And here's why I think that happened. And here's the evidence for it. This is not my opinion. Here's all the evidence, and I have it cited, and it's in the endnotes for you to look at if you want.
Well, David, we don't have time to talk about this wonderful book, Invisibles, but it does seem like, you're someone who identifies with the subjects of the book, and you're someone who clearly has intrinsic motivation driving you, not a desire for fame and fortune. But nonetheless, when you move from fact-checking to journalism, you can't avoid having to pursue the limelight, right? I mean, you have to do podcasts. You have to promote your work. You have to be out there. I mean, do we live in a world where it's getting harder and harder to be successful without also being a self-promoter? I mean, do you have to,
I think it's hard. And it depends on what field. Look, you can't just be a doormat, and you can't just assume that people will find, you could write something brilliant, but if you just stick it in a drawer, no one's going to know about it. Or even if it gets published, if it's just sitting on a shelf in a library, no one's going to know. So you need to have some modicum of effort made to bring something to the public or to whomever the audience is. But with that said, I think there's a lot of pretty persuasive evidence that having a lot of attention in the end doesn't generally, there are some people who are quite good at this, but for the most part, if you're trying to become successful, simply generating attention for yourself is not going to be a lasting path to success, but rather doing good work tends to bring attention. That we have this cart before the horse thing where instead people are seeking attention and then they try, and then the work is sort of secondary. And again, I'm sure some people manage to get some position at some university, or whatever else they're seeking when that happens. But generally, and I interviewed this guy in Invisibles, the book. He is a freelance journalist, and he said the phrase that getting a lot of followers online, because journalists are always trying to get like a bigger follower count. He said, having a lot of followers did not really lead to me getting a lot more work. He said, but doing good work helped me gain followers. That if you just do good work, in the end, things will come to you. Yep, and it doesn't happen magically. You have to push. You can't just hide. But that's, it's a fairly, I don't know, I guess, unsurprising kind of finding in the end. But it's something that, of course, is so easy to forget within our culture where people want attention so badly. I mean, my personal profile went up during the pandemic, but that wasn't by design. That just happened because I was the only person, by and large, who was writing about this stuff in kind of prestige legacy media outlets. And I got an enormous amount of pushback in the beginning. So I wasn't thinking about the external thing at all. I was like, this is important. I don't think anyone's writing about this really. I need to do it. And people call me a murderer, and on from there. Was cast out in any ways. And ultimately, though, in the end, here I am talking to you on your podcast. That wouldn't have happened otherwise. So I think you just, again, this is probably a fairly almost like a, college, like a graduation speech, but it's like, you got to just follow what you enjoy and do really good work. And the other pieces will come into place. I think there's pretty persuasive evidence that is a good path toward success, or at minimum, a good path toward a more satisfying life, even if not success. At least that's a way to be far more satisfied, is to just do work that you find intrinsically valuable.
Well, both of these books are good work, and so I'm hoping that they continue to get lots more attention. David, thanks so much for joining me. The newest book is called Abundance of Caution. Check it out.
Thanks, Gregory.
Unsiloed podcast is produced by University FM, elevating the stories of your institution.